Hi Biology, Mr. Wagner here, taking you through the anatomy of the axial skeletal system. This is going to be in your note packet. The note packet, it says both bone and muscle notes. Okay, it's in the folder, and you're just going to do the first part on our unit on bones, and then we have the same packet already set for our unit on muscles, which will be our next unit following this one. Let's get started talking about the axial skeleton. The axial skeleton is what runs up and down the center. This is my axis or axle, all the way down through my spine and through my pelvis. Anything that kind of sticks off to the side, like my arms and my legs, that's going to be part of my appendicular skeleton. Axial is like an axis right down the center. Let's take a look and see what all that includes. There we go. Okay. Axial system facts, or skeletal system facts. This is the entire skeleton, by the way. 206 bones in an adult. That's 350 cartilaginous bones as a developing baby. You're thinking, well, a baby is a lot smaller. Why would they have more? Well, in order for the bones to grow, many of these cartilaginous bones have to fuse together. So where I've got 3 or 4 different bones as a baby, and the reason I need to have them cartilaginous is that they give a little bit more so I can make it out of the birth canal. So they're not like solid. Otherwise, they might poke and protrude somewhere along mom, and that's not going to be good. But I might have 3 or 4 different bones that may all kind of join together as cartilaginous bones that eventually solidify into one single bone as an adult. So as an adult, you're going to have less bones than you have as a baby. Skeleton reaches full maturity by age 25. Supports the body and protects vital organs. These are the functions of the skeleton: protect the body, support the body, and protect vital organs. It manufactures blood cells at a rate of 1.2 million per second. That's right, inside your body right now, 1.2 million blood cells are being manufactured every second. Allows the body to move by connecting to the skeletal system. Okay, the muscles that connect to skeletal muscles. The muscles then hook onto these bones, and with muscles then I can do movement, which I couldn't do before. So they are the support or the framework. Skeletal system stores excess minerals, primarily calcium and phosphorus. There are ligaments. Ligaments connect bone to bone. I like to remember blab. Bone, ligament, and bone. B-L-A-B, blab. Ligaments are like not blob, but blab. Bone, ligament, and bone. Tendon. Tendon connects muscle to bone. That's why I want to remember blab, so that I know that it's going to be bone, ligament, and bone. Tendon is the part that connects the muscle to the bone. Tendon. There are 2 broad divisions in the skeletal. The axial skeleton, as I said earlier, up and down, runs down the center. And the appendicular skeleton is anything that sticks off to the side. An appendix is something that kind of comes like at the end of a book. It's like added on. So stuff added on to the center. So today we're only going to talk about our axial skeleton. It includes the head, cranial and facial, spine and thorax. Just as a note, of course, you're filling in your note packet while we're doing this, and then you're going to use your note packet to then help answer some questions and do some other assignments. So make sure you're filling in your note packet. If you're not, stop, go back, get the notes, print them out. They're available at school, or you can print them out from the folder that we have here. All right, the cranial and facial, that's the head, the cranium, that's the scientific name. Spine and thorax. Thorax is my chest region. There are 80 bones total. Primary function is to support and protect the internal organs. Cranial bones, these are bones in the head. Made of 8 bones. This is what you're going to have on your coloring packet. You're going to color 2 parietal bones. Those are on the side. You're going to color a temporal, like your temple. This is where my temples are. This is the bone that covers my temple. I'm sorry, temporal is actually down here on the side. My apologies, on the side. Frontal is the one in front, and occipital is in the back. Then there's 2 more like the ethmoid and the sigmoid. They tightly fit together without movable joints. One purpose is to protect the brain and other organs located in the cranium. Cranial bones. When bone joints are not fused, instead connected by cartilage called fontanelles. So when you're born, the joints are not fused. And why is that? Because as a little tiny baby, your brain's got to get bigger and bigger up to this size. So I want to make sure that as my brain grows and my head grows, that the bones are not solid and then they push up against it. So instead the bones are a little bit rigid, or not quite as rigid. They grow as the head grows. And what happens is there's a spot right in the top of the baby's head. Often if a newborn baby, you have to be very careful, where the bones are not yet connected because the baby still has to grow. That's called the soft spot. Skull growth is not complete until age 4, which is why actually if you see like a 4 or 5-year-old child, often their head looks like it's not in proportion to the rest of their body. And that's true, it is, because the child is only this tall, but the head is like a full adult size head. The rest of the body is going to catch up. Areas where bones join are the sutures, just like in the medical term, sutures, sewing something together. It often has this interlocking pattern like this. You'll see that in your coloring aspect, that you have to color, that there's this like jagged line back and forth. That makes it a stronger seal. Again, the jagged edges of the suture give strength. Facial bones, made of 14. The maxilla, zygomatic, palatine, nasal, again, that's by your nose. Lacrimal, that's kind of like where tears come from. Inferior nasal concha, the mandible. The mandible is your jaw. This is my mandible, this is my maxilla up here, and the vomer. You're going to color all those so you'll know what they look like. The maxilla and the palatine form the upper jaw and the roof of the mouth. The mandible forms a lower jaw. The mandible is the only movable bone in the skull. The only bone that moves in the skull is the mandible. Only one you can go back and forth, up and down. Mandibles allows us to talk. Auditory bones, made of 6 bones, 3 in each ear. Malleus, incus, and stapes. Maybe you remembered them when you were little as the hammer, anvil, and stirrup. The hammer, anvil, and stirrup. Yep, there they are right there. Hammer, anvil, and stirrup. They are the smallest bones in the body. Smallest bones in the body are the ones in your ear, and they're necessary for hearing. They vibrate back and forth. In fact, that's something characteristic of mammals. Mammals have 3 bones in their ear, unlike birds or reptiles or anything else. The hyoid, only bone that does not articulate with another bone. What do you mean articulate? Well, it doesn't kind of like hook up and pivot or go back and forth. Like my elbow here, this bone and this bone connect kind of to this one. They articulate and move together. The hyoid's just kind of floating around, held together with some cartilage and some other tendons and tissue, but it's not really articulated with any other bone. It's U-shaped, and it's the point of articulation for many muscles like the tongue. The tongue way in the back hooks up to this hyoid, and the pharynx also hook up to the hyoid bone. It's found just above the larynx. The larynx is your voice box. Bones of the spine. The vertebral column, general information about it. A vertebrae, plural, vertebra, singular, made of 26 vertebrae, originally 34, but 5 sacral bones fused together and 4 to 5 coccygeal bones fused together. We'll show you what that looks like. You'll actually see that when you do your coloring packet. Intervertebral discs allow the spine to bend and act as a shock absorber. So I got my spine and another spine, a vertebrae and a vertebrae, and in between them I got this little disc. And because of this disc, now I can kind of bend one way or the other. I can kind of twist and bend a little bit because I got this shock absorber in between there. And maybe you've heard about people having accidents where they have a slipped disc, where the disc has kind of like been pushed out or ruptured, and then it's very, very painful. Having a hollow area through the spine for the spinal cord to pass. Spinal cord goes right down through these vertebrae. Cervical vertebrae. First 7 are called cervical. They're C1 through 7. C is for cervical, 1 through 7. The first one has a special name. It's called the Atlas. Atlas, of course, in Greek mythology was the gentleman who supposedly was cursed that he had to hold the world on his shoulders. It's pictures of this world sitting on this guy's back. That's Atlas. And the reason it's called the Atlas is because basically our big bulb of a head, our globe of a head, kind of sits right on this. That's where it's holding it up, is this tiny bone called C1, the Atlas. Point where the head is connected to the spine, allows the head to pivot up and down. This is what an axis allows us to do. And then the axis, so the Atlas allows up and down. The axis is located right below it. So I got my Atlas on top, my axis right below it, Atlas and axis. And the axis allows the head to go left and right, or bend left and right. Left and right is the axis. So the Atlas up and down, axis left and right. Other cervical vertebrae allow the head to tilt and move in other directions. Yep, tilt and move in other directions. C1 and C2, those are special ones. After that, they're just C3, 4, 5, 6, 7. Thoracic vertebrae. Your thoracics is your chest area, made of 12 vertebrae, again called T, 1 through 12. So if you have like an injury or something, the doctor may say there's an injury to your T7 vertebra, something like that, T7. And they're all numbered. Larger than the cervical vertebrae, they get a little bigger. The attachment point for the ribs, this is where my ribs hook up to. Ribs hook up to my thoracic vertebrae, and you're going to color those again in your coloring packet. Lumbar vertebrae, L1 through 5. That's like my lower back. In fact, sometimes maybe your mom or grandma or something or dad might have to use a special pillow on their back when they sit called a lumbar support that actually supports those 5 vertebrae back there. They are the largest ones. They're very, very big. They form the lower back, and they support the weight of the entire upper body. The entire upper body is all resting upon those vertebrae. That's the only connection point. So they have to be really big and really solid. That's why people often have back problems because of the lower vertebrae. If you have a back problem like a sore back or a bad back, it's usually because of your lumbar vertebrae. And then finally we have sacral vertebrae. Sacral or the pelvic vertebrae. They're made of 5 vertebrae that are kind of fused together in adults. So again, this is an example of when you're a child, you'll have maybe 5 of these, but as an adult, they all fuse together and you have now only 1. Also called the sacrum. Joined to the hips to form the base of the spine. And the last one is called the coccyx. Made of 4 to 5 vertebrae all fused together again. Also called the tailbone or a coccygeal vertebrae. So if you ever like miss your chair and fall and you hit the floor, this is usually what you're going to hurt or hit. Used for muscle attachment and a shock absorber for the spine, the coccyx. Now there are curvatures of the spine in the average person. There's 4 of them. There's called the cervical lordosis. So again, cervical would be my neck vertebrae. Remember, those are my C1 through 7. And then the lordosis means that it curves like toward the front of the body. The thoracic kyphosis, a kyphosis means you're kind of hunched back. You can see some pictures when you do your coloring packet. It'll talk about the curvatures, and you'll actually color those, so you'll see what we're talking about. A lordosis kind of pushes toward the front. A kyphosis kind of pushes toward the back. So if someone has a very bad thoracic kyphosis, they might be a hunchback. All hunchback may be too much of a bend. There's the lumbar lordosis. Again, if you feel your lower back, it kind of goes in. It kind of pushes toward your stomach a little bit. And then the sacral or coccygeal curve, which again pushes back out toward your backside. All right, these provide, what do curves do? The curves actually provide additional strength and flexibility. Okay, actual strength and flexibility when you put a curve in something. If it's just a straight line, it's easy to buckle, bend, or break. But if I put a little bit of a curve in it, it supports the weight a lot better. Now, if there's excess curvatures, then you can have problems. Scoliosis is when you have a lateral curvature. In other words, it's going to the left or to the right. It's bending a little bit left or right. That's scoliosis. If you have kyphosis, again, this is that humpback, you have an excess where you're bent way over too far. My shoulders and my chest area are bent over way too far. And that is called humpback or kyphosis. The lordosis, again, that could be a sway back. And that would be like if my lower back area goes too far to my stomach. Then I've got this big curve in my lower back, and that's called sway back. And that would be a problem with my lordosis. Again, lordosis pushes toward the front of the body. All right, ribs. Ribs are made of 24 bones. That's 12 pair, 12 on each side. Attaches to the thoracic vertebrae in the back and by cartilage to the sternum. This is my sternum, the breastbone. The first 7 pair, anyway, attached directly to the sternum. Cartilage is flexible, so the ribs can expand and contract during breathing. Again, why there are not big, heavy plates here? Because ribs do a fine job to protect us from most of the stuff that we're worried about that might damage our lungs or our heart. Lungs or heart. So ribs do a great job, and they're flexible enough so that when you take a deep breath, they can expand. And when you breathe out, they can come in. So I have to have a balance between solid. I could be just completely solid, but then I wouldn't be able to expand or contract. So this is a nice combination of the two. It allows us to expand and contract and still allows really good, solid protection for the lungs and the heart. There are 3 types of ribs. True ribs, these are the first 7 pair, 1, 2, 3, 4, 5, 6, 7. They attack directly to the sternum. The sternum is that breastbone right there. There are false ribs. Those are the next three pair. They attach actually to a bunch of cartilage, and then that cartilage attaches to the sternum. You'll see that in the coloring packet. It'll be quite easy to understand. And then the last one, we have two pair of something called floating ribs. They do not attach at all. They do not attach at all. They just kind of like stick out, and they just kind of like hang there, and there are these ones way, way in the back, and they just kind of protect your kidneys and some other areas back there. But they don't come all the way around the front. And that's what allows us to kind of get a good bend in our side. I can't really bend my chest too much, but I can bend at my side. Why? Because I don't have ribs that continue down. Sternum, known as the breastbone, contains the manubrium, the body, and the xiphoid process. The manubrium, the body, and the xiphoid process. You'll color all of those on your packet. And it is the last bone to ossify. Ossify literally means to harden. To harden. So the last bone in your body that becomes completely solid and hard is the sternum. Ossify means to harden or become solid. All right, this is all we got for our notes on the bones of the axial skeleton. Axial skeleton. Next unit will be appendicular skeleton. All right, make sure you got all these notes filled in. You'll need them for your assignments. Take care, God bless. Have a good day.